everyone, and welcome back to another episode of It's Okay Not to Be Okay. Um, in today's episode, we are going to talk about a topic that affects a lot of people, teens, adolescents, families, the people they love. Today we're talking about clinical depression in teens. And to help us out, as always, to answer, any confusion that we have is Dr. Buksani. Hi, how are you?
Good, good, Amanda. Um, Again, I am so glad we're talking about teen depression because obviously we've seen those statistics, and I know before we started recording, you and I were talking about it. But do you want to mention some of those? Because we also had that moment of what, like how? But yes, do you want to give the stats
Yeah.
on teen depression?
Absolutely. As of 2023, a study done found that 2 out of 5 high schoolers report feeling consistent sadness, and then 1 out of 5 high schoolers go through a major depressive episode. In more recent years, in 2024, a study found that about 5.2 million teens experience at least one major depressive episode. Obviously, these numbers are really high.
Yes. It's scary, right? It almost makes you wonder what we doing
Right.
to our teens. But yes, so very important topic. I'm glad we're discussing it. I'm going to leave the floor to you to ask me whatever you want to.
Perfect. Thank you so much. As always, just for the people who do need clarification, can you start us off with what is clinical depression and how is it different from, just typical teenage moodiness or just being sad?
Sure. So whenever we talk about a diagnosis, it has to be something that affects the social and academic function, right? So right there, you know that if it's not persistent, it has to be minimum for 2 weeks. You have to see the symptoms of depression, which include things like sadness, the anhedonia, which is the lack of desire to do things that I previously enjoyed. Sleep is affected, my appetite is affected. So you do need to see those symptoms persist for at least 2 weeks, and it needs to affect your teens functioning socially and academically. That's when we categorize it as a disorder. Now, in regular mood swings, there's an up and down. But this is, again, for 2 weeks, your teen is just unable to get out of bed. Or, like you're seeing your teen constantly crying, but it's been 2 weeks and there's nothing that lifts up their mood, right? So that's when it becomes sort of a red flag, and you might want to reach out for help.
Okay. Yeah, thank you. Bringing up parents and stuff, are there some common signs of depression in teenagers that parents or caregivers that might miss?
Yes. So I feel it can show up differently, because when we talk about depression, we generally talk about that sadness, that the crying, the sadness. But sometimes, and especially for teens, it doesn't have to show up as sadness. It can show up as anger. It can show up as irritability. Withdrawing from my social situations. Of course, we talked about the sleep and the appetite problems, and we talked about the loss of interest. But I think what's different is, in teens, there might be more of that irritability, the anger, rather than the traditional sadness that we see. That's not to say that some teens will not experience, depression in a traditional sense where it's sad. But I don't want people to miss that the anger and the irritability as signs of possible depression.
Right. Of course. Yeah. As teens, I feel like hormones are crazy and everybody experiences something similar to that. What are some of the factors that contribute to clinical depression in teens?
Social media.
Yeah.
One of the factors. I often wonder about that myself because, growing up, we it was a very different world, right? So I mean, I went home, we had no smartphones. So, our contact with our friends was okay when we had school, and then there was, the little dial phone. So there was one in the house. So you couldn't really be on the phone for that long because there's so many other people in the house that need to use the phone. But it was great because you could actually disconnect and you could have your own life, where now I feel that that's almost impossible. There is so much of a pressure to always keep up appearances. And I don't mean appearances in the how am I looking, but just appearances of where am I holidaying, which parties am I attending as teenagers. So I think it's a lot more pressure on teens today than it was when I was growing up. Of course, there's a genetic factor, so there's always that nature and nurture that kind of work together. But I think what exacerbates it nowadays is the fact that, the teens are really not getting downtime. I mean, I have 2 teens at home, and on their Snapchat, it's freaky. It's like stalkish. They know exactly where their friends are all the time. Why do you need to know why if everyone is at every given point? Because, and then at that point, what happens is you're questioning, but so and so are hanging out without me. So,
Right.
And then that throws you in for a loop of like, oh my gosh, do they not like me? Do they not want to be my friends? Very real emotions. So I feel like there's just no turning off. I also feel life in general is a lot more difficult for teens. I'm going through the college process with my daughter, and I have realized that that's horrendous. You have to be the inventor of the spaceship to be able to get into, and then also we don't know if you're actually going to get into these colleges. And it's funny because I was actually talking to my daughter who's now in the process of applying for colleges, and I was telling her that when I went to college, the acceptance rates were about 60%, 50%. Now it's 3%, 2%. I mean, the immense pressure on teens to be able to perform, I think is a lot. It's so that rat race, I think, has, where earlier it used to start a little later in life. I think now it's starting earlier. So teens are feeling a lot of pressure with that. And thirdly, I think it's us as parents. I feel like, I don't know if we as parents are, necessarily parenting in a way that's making our kids more resilient. Making our kids accept failure, making our kids take accountability for their choices and their decisions. I do believe we try to, mollycoddle our children or protect our children, but to the extent where I think now, a little stressor can weigh heavily on them. So I feel it's probably a combination of both. There's life itself that is much more difficult for teens than it was when I was growing up. And then also I think parenting has changed. And I feel both those factors together is probably, and then of course genetics, can't discount that, but that together is probably what I would say is contributing to this.
Yeah, I can definitely see that for all 3 points. I mean, Gen Z, being part of Gen Z, I believe is the first generation to experience their entire life with the internet, social media, smartphones, all of it. So I do believe it is a huge factor.
Yeah.
Into everything. And then school, high school for some reason was
terrible.
It has gone. Was like a million different programs have opened up,
and you feel like you have to do it all. And what's sad? I was actually watching something today, and it was very interesting. So it was talking about how seniors in high school, it's a year to actually celebrate, right? Because you have you're completing your high school, you worked so hard, and now finally But seniors are one of the most stressed, groups in high school, because forget about, being mindful and enjoying your present, because you're so stressed out about the future and the college applications and am I getting accepted? Am I not getting accepted? So you like that we're stealing that away from them. So it's quite sad and it's quite hectic for teenagers.
I mean, it was like a 50-50 senior year for me just because of the program that I was in, but I was finishing high school. So I think it's definitely one of the most stressful times. I mean, taking that into account, how does depression affect, a teenager's self and their own identity?
Yeah, hugely.
Right.
So I think, when we talk about self, going back to IFS and where we talk about self and what are some of the components like courage, confidence, calm, clarity, it affects all of it, right? So, your sense of self, and listen, teenagers are in the process of figuring out who they are anyways. It's not like they already know, right? So it's a difficult job at that point to try to figure out who you are. Now this really, really complicates that process and that, and that sense of self. So, a lot of teenagers really lack that self-confidence. They struggle with low self-esteem. But of course, again, because those are components of self,
right,
that self is definitely affected when I, don't feel good about myself, my life, and if I'm undergoing depression. I also think it affects them socially. So there's such a big, because a lot of teens will withdraw from friends. They, won't feel like meeting people or building their network or having fun. So it affects them socially and emotionally to a great extent.
That is a lot. And I feel like taking all that into account, I feel like it just continues to add to those already like huge emotions that they're feeling.
Absolutely.
Yeah. I mean, in regards more to the parents and caretakers of these teens, which is already a difficult job in itself, when do you think parents or carekeepers should consider reaching out for professional help?
So going back to our first question of how do you know that my teen is actually depressed versus they're going through their hormonal ups and downs, that's very relevant. If you do see, your teen for an extended period of time, either being very angry, irritable, being sad, not like having lost interest in activities they previously enjoyed, withdrawing from friends. And sometimes there are also physical symptoms that you need to be watchful, so stomach ache, headache, constant. So you might want to pay attention to that. And if that is chronic, so if it persists for 2 weeks or beyond that, then yes, I think it's time to reach out for help and talk to your teens. They might be able to, tell you that, yeah, I think I need to speak to someone.
Yeah, I mean, I know parents are also nervous to take that step because it is a huge step. Do you mind describing maybe what treatment for clinical depression in teens would look like?
Sure.
So there are, I think every possible therapeutic orientation takes care of depression, right? Like, I mean, we deal with depression. So some of them are more symptom-based, right? So CBT, for instance, cognitive behavior therapy, it's more, okay, how can I reframe my negative, irrational thoughts? How can I, add some behaviors into my life that will help feel better? And, those techniques seem to work well with teenagers who are also more structured and concrete. They like those. But frankly, any of the techniques, and remember, Amanda, most of us therapists are using, we're eclectic. Like, we kind of pull from different therapeutic orientations when we are, taking care of the person who's sitting in front of us. So from solution focus to CBT to ACT to mindfulness techniques and DBT skills, all of those can help with teen depression. It really depends on what the teen who's sitting in front of us needs at that point and what we can pull from. And remember one thing, when you are looking for support for your teenager in terms of a therapist, what you really need to be mindful of is to make sure that there is a connection. Your teen actually is able to connect with the therapist, because it doesn't really matter what technique she's using or what therapeutic orientation she's using. What matters is that your teen can actually trust her, and there's that connection over there.
Right. Absolutely. I mean, teens don't really open up as much already as is. If there's not even, like the slight relationship built,
Yes.
they're not gonna talk.
Yes, absolutely.
But yeah, I mean, thank you so much for helping us along this huge topic. I feel like there's always more to talk about when it comes to it, but I am happy that we were able to, get the basics down. What it is, what it could look like, treatment, and, encouragement to go seek help for those parents and teens that are going through it right now.
Yes. Yes, absolutely. And I would encourage parents, if you do see signs, because you know what, it's a very emotional thing when you see your child going through something. You don't have to do it alone. There is help available, so reach out. Add to that support system.
Yeah, absolutely. Well, thank you so much, Dr. Buksani. I was so happy that we were able to cover this.
Absolutely, Amanda. Till we meet next time.
Bye. Thank you.